The title of our poster is Correlation of Liver Stiffness with Clinical and Laboratory Parameters in Pediatric Patients with Shwachman-Diamond Syndrome. SDS is an autosomal recessive disorder characterized by bone marrow failure, which can lead to malignancy, exocrine pancreatic dysfunction, and metaphyseal chondrodysplasia. Within the first several years of life, patients with SDS tend to have elevated liver transaminases and clinical hepatomegaly, which is thought to be related to immune dysfunction and malnutrition. Case series of percutaneous liver biopsy specimens performed have shown steatosis, portal inflammation, and early fibrosis. However, SDS hepatopathy does appear to resolve with age based on long-term follow-up of hepatic transaminase levels as well as liver MRI. Still, liver failure related to veno-occlusive disease has been described with stem cell transplantation in SDS patients. No prior studies have examined the use of transient elastography in this patient population. The aim of our study was to investigate the correlation of liver stiffness measurement by TE to clinical and laboratory measures in patients with SDS to assess for possible subclinical liver disease. All patients aged 0 to 25 years with genetically confirmed SDS seen in the pediatric GI clinic from July of 2017 to November of 2019 were included. Exclusion criteria were patients with known underlying liver disease, prior stem cell transplantation, history of liver transplantation, or pregnancy. 8 patients, 6 of who were female, were identified with genetically confirmed SDS, for whom the median age on the day of TE was 6 years. Median weight for age Z-score on the day of TE was minus 0.73. Median height for age Z-score on the day of TE was minus 1.37. The median AST and ALT were 31 and 30 respectively, obtained within a median of 18 days from the measurement of LSM. All patients had exocrine pancreatic insufficiency as defined by fecal elastase of less than 200. All 8 patients underwent TE with a median range LSM and CAP measurement, which is a measurement of steatosis, of 5.2 and 171 respectively. LSM was negatively associated with an AST and ALT with an LSM of greater than or equal to 5.7 or F1 fibrosis, more likely among patients with versus without a normal ALT and normal AST, respectively. In conclusion, in our cohort of 8 patients with SDS, 4 were found to have abnormal TE as defined by an LSM of greater than 5.7 corresponding to F1 fibrosis, and those patients were more likely to have normal ALT and AST than those with an LSM of less than or equal to 5.7, suggesting that subclinical liver disease may exist in SDS patients with normal liver function tests, and that larger studies are warranted to confirm the findings of this case series. Thank you.